We're just waiting for one of them, but I will make the introduction. But let me just start off by saying that we are going to be talking about something really, really important today. It has been advertised, so I hope people can come in and have a chat, ask questions from our experts. And what we're going to be talking about is something really topical, something that often comes up, but we don't completely touch on it. And what we're going to be, and the topic is, it's men's physical and mental health. The challenges, what are the different forms specific to men? Are men able to come forward? Are they able to talk about them? If not, why not? And what are some of the challenges and also the solutions? Because we just don't want to talk about the challenges and the difficulties, but we also need to touch on some of the solutions. And that's why we've got a couple of guests with us who I'll introduce now. Now, in order to interact, that's what we're here for. And we want you to ask questions. There's various ways you can come in. Either you can do what we're doing now, is just to log into Ramadan Radio, ramadan.radio.fm on 87.7, or call us on 0116 482 2086, or send it as text or a WhatsApp message on 07748 855 055. And we are live streaming on Facebook and YouTube. So if you happen to miss the show, listen to the recording, and you'll have options there to put in questions as well, and we'll try to get back and answer all the questions as much as possible. Now, what I'm going to do now is I'm going to invite, we've got a couple of guests, and one of them we're still waiting for, but we've got Professor Tayyeb Tahir, who's a professor of liaison psychiatry, who works in Wales, in Cardiff. Now, myself and Tayyeb go back a long way, and the other guest who's going to come as well is we go a long way, because we're all from the same medical school. We are Rawalians. So, hey, a shout out for the Rawalians on the radio show today. So I just want to give a big welcome to Professor Tayyeb Tahir.
Thank you very much, Shahid. It's a pleasure to be here. And thank you for having me on your very popular show. And I'm very grateful that you've brought up a topic which is very close to most psychiatrists' heart.
Absolutely. And thank you for sparing your precious time on a Sunday morning. And I know that you're very busy, man, not just in your job, but also in your family life. I rang Tayyeb the other day, and I said, listen, are you okay? He said, can I call you back later? I'm just on my way to the airport. I said, okay. And I said, everything okay? I said, somebody leaving or coming to Pakistan? He goes, no, I just have to pick up somebody and bring them home, because they're here for a little while and I'm just looking after them. I said, okay. And I said, who is that? Someone we know from our college? He said, not from our college, but somebody we do know. And it was none other than the international Pakistani fast bowler, Shahid Latif. So, yes, I'm going to be throwing a lot of fast deliveries at you today, Tayyeb, so be prepared.
I'm ready for bounces.
You're ready for bounces, as always. And we have also our other guest who has joined in. It's none other than Dr. Ayesha Zafar, who's a general practitioner. Welcome, Ayesha.
Hi, Shahid. Assalamu alaikum, everyone, and happy Ramadan.
Wa alaikum salam.
Thanks a lot. Thanks a lot for inviting, Shahid.
You are most welcome, Ayesha, and thank you again for coming in and sparing your time on a Sunday morning. With all our sleepy faces on Sunday morning, because weekends we do sleep in, but obviously I really, really appreciate. So anyway, I'm going to go straight in to the Q&A, and we've already discussed ways. Please do call in and ask our wonderful experts questions. So let's start off with Professor Tayyeb Tahir. And Tayyeb, let me ask you, men's, obviously you being a psychiatrist and Ayesha being a general practitioner, so we are talking both about mental and physical health. But please feel free to overlap, because I know Tayyeb being a liaison psychiatrist and Ayesha having an interest in mental health as a general practitioner, I'm sure these discussions will overlap. So let me start off with Tayyeb and ask about his experience of what are the common mental health issues or difficulties or disorders or symptoms that he has encountered, which not necessarily just confined to men, but maybe mostly seen in men.
Okay. Before I answer your question, may I say that no health without mental health. That's a slogan that you and I, and many of the psychiatrists have worked with and physical and mental health go hand in hand. And to fulfill the definition of WHO on health, you need to address both to improve the social well-being and social health, and hence improving the health of the nation and individuals. There's a big gap between physical and mental health, and half my role is spent bridging that gap between physical and mental health. There's a parity of esteem that's really important to be addressed. In modern health service, it's essential to bridge that gap between physical and mental health. And since you're talking about men, those at the critical age of 40, above 40, 45, 50, when they start getting some physical health problems, those are the time points when every contact should be counted, and individuals, men or women, they should be asked about their physical health as well as mental health. Hence, screening for mental health should be universal. It's a vital sign. We cannot ignore it. So you asked about disorders, all disorders, anxiety, depression. Even if we talk about spectrum, from stress to serious mental illnesses like bipolar affective disorders, schizophrenia, and in young men growing up, ADHD is a common thing that we never addressed. And now adult ADHD is an important factor to consider. And that has a huge impact on both physical and mental health. So to answer your question in a nutshell, it's all disorders. So we need to address each and every, at every point, we need to address mental health along with physical health.
Fantastic. Thank you, Tayyeb. You've actually answered the question, and I think that's the first message which needs to go out to all our listeners, and that is men can experience all kinds of mental health problems. And the reason why I say this is really important is because when we do follow up the discussions in our questions, we are aware that although we have many people from different genders, from a male and female gender background coming forward, why are they reluctant to come forward? And as Professor Tayyeb Tahir has highlighted, men are not immune from any mental health problems. I'm going to ask the same question to Ayesha. Ayesha, physical health. So in your many years of being a general practitioner and with all your experience, is that something similar, or do you see a certain cohort of physical health problems in men specifically? Or again, is it a very similar, obviously men can't get pregnant, obviously, but I'm talking about other disorders or problems. So over to you, Ayesha.
I think as Tayyeb has mentioned rightly about, both mental and physical health go hand in hand. That's I think the core of every ailment they present with, because they're so closely interlinked together. Physical health, I think men are very reluctant. Most of the time they present to me via their partners. So their partners are booking the appointments, or they're forcing them to come to the GP. I mean, to get an appointment with GP is difficult anyway, which is another topic. But even if they come to see us, it's the first thing they would say to me is that they were forced by their wives and their partners to come and see us. They're quite reluctant. And I think part of the problem is because I think, one, they're embarrassed. And second, they're quite uncomfortable seeing a GP. There is this macho thing that goes on with men as well, with the, that sort of is instilled and sort of hammered into their brains right from the start, as that nothing can happen to men. They're strong, they're superheroes, they're, that kind of stereotyping. Most of the cultures, I think, they've got that kind of stereotyping. But so that's at the background, with men being tough and strong, and they'll get better on their own. So there's no need to see the GP. So that is the kind of cohort that comes to the GPs, and they come quite late when when the problem is escalated, physical problems, or even mental, and the family is sort of seeing and observing them. So they present at that point. Even when they present to me, they would talk about something else and not the actual problem. So they would say, oh, actually, I don't think there is anything wrong with me, but my wife says I'm always tired. And actually, the moment they say that, that's where we know that we have to put more effort to sort of dig out the real problem. Yeah, I think it's difficult consultations with men around that particular age that Tayyeb has mentioned, where they start getting physical ailments, they start getting mental stress. So we have to work extra hard to sort of dig out the real problems, and also to advise a man is also difficult because they don't want to be told. They don't want to acknowledge any problems in their life. That is another thing. So yeah, that's how they present.
Absolutely. And Ayesha, you've touched on some really, really important points here. I mean, as a psychiatrist, I'm aware, there's cultures within cultures where, although we're talking about men's mental and physical health overall, but you've just touched on something which is, excuse me, very, very important. And that is two things. Number one, they often come in and say, well, my wife or my kids or my family asked me to come. I don't think there's anything wrong. And number two, if they are experiencing some form of mental health breakdown or difficulties, I'm not saying disorders on purpose, because not every psychological or mental health difficulty is a disorder. There may be some emotional dysregulation, etc., or having a bad day or ongoing bad days. So, Tayyeb, in your experience, I just want you to throw some light on this and what might be the reasons why, number one, from a mental health specifically perspective, why would men find it? I mean, Aisha's already touched, you already touched the alpha male, the macho, masculineness, obviously, is that affected? And number two, physical health. A lot of mental health is presented in men in physical health terms. Would that be correct? Is that your experience as well?
Absolutely, and I can tell you a number of stories without breaking any confidentiality. I've had big 6'10" international sports players, athletes, firemen, policemen, people who've been in jobs of responsibility, protecting us and protecting others. When they've had problems, physical health or otherwise, usually it takes a big life event for them to present and be in contact. Simple statistics. You and I know that most people who get referred to us in our psychiatric clinic are women, whereas 1 in 8 men will have a mental or psychiatric disorder of some sort. And let me throw in the big elephant in the room, the S word, the self-harm and suicide. Now, that is a crucial turning point for men. And you know very well, Shahid, that majority of people who commit suicide are men. 1/3 of those are men. So the barriers are late presentation because of what Ayesha said, the macho. But then there's this social subculture within any culture, not just within the Black and ethnic minorities, in any population, Welsh, English, you name it. People think that they are strong. I can deal with it. I'm the head of the family. I am responsible. I've got other things to deal with. This is the last thing on my plate. So those are the barriers. And then there's that stigma. We've fought stigma around mental health problems in my career right from the beginning. Soon after I left medical school, stigma around mental health concerns. So men don't want to come because of those responsibilities and subculture issues. Then they've got those stresses of jobs. I can't have mental health record on my medical records. They ask specifically, is it going to go on to my medical records? And you have to just simply say things like, what if you had diabetes? If you had hypertension? What if you had a cardiac illness? Would you not go and see a doctor? Why are you not seeking help there? And in general hospital setting where I work, I know for sure we have collected a lot of data around this. In any specialty, you name it, cardiology, neurology, pain clinic, immunology, rheumatology, physical health screening. If you do mental health screening alongside physical health screening, people come up with high scores for common questionnaires like PHQ-9, which is a free questionnaire in GP land. But for general public, the message is, if you are feeling tired, if you're feeling irritable, unlike the core symptoms of depression, for example, let's talk about depression, low mood, decreased energy, loss of interest, helplessness, hopelessness. If you have those symptoms, those are barn door open symptoms for depression. But it's important to ask about irritability, about anger, but don't forget about drug misuse, poor coping strategies. People might not present with clear-cut symptoms. They might just present with atypical symptoms, and you've got to be familiar with those symptoms. And hence, I tell my colleagues, whenever I'm talking to colleagues in physical health or in general practice, I say A, B, C, D. Ask about mental health symptoms. Bridge the gap between physical and mental health. Consider referral to mental health services. Drugs and substance misuse, poor coping strategies. Address those. If you keep those A, B, C, D in your mind, then you will never miss talking to patients about their psychiatric or psychological or mental health symptoms. So that's the message I tend to give every day almost in my practical life.
What a beautiful message, absolutely. And I think you've just covered a lot of things just by giving those ABCDs. And you know, the crux of it is communication, isn't it? Absolute communication. You're listening to Ramadan Radio 87.7. I'm your host, Dr. Shahid Latif. We're on Ramadan.fm. Please give us a call. Ask the experts questions on 0116 482 2086, or send us a text or a WhatsApp message if that's what you prefer to do on 077 48855 055. And we are also live streaming on Facebook and YouTube. So feel free to join us in there as well. And you can ask questions there too. Okay, so really, really important points, and I think we've highlighted, or our experts, both Ayesha and Tayyeb, have really highlighted some important elements specific to men from both the mental and physical health perspective. Ayesha, what, in your hands-on experience, I mean, you've already touched on the difficulties and also the overlap as well. What can you give us, you know, without naming names, and I'm sure you won't be breaking confidentiality, can you give us some examples of, you know, in your experience, of your years of experience, of how men differ from females or ladies when they do present?
As I said before, Shahid, it's first of all, they don't want to come, so that reluctance is there. The way they present, most of the time they're accompanied by their partners, and the partner is the one giving the history, or they don't even talk. And I think it's there's a gender difference, obviously, with women more comfortable talking. And I think there was a study in US which showed that women are more exposed to medical profession quite early in their life, which men aren't. And that's because of the reproductive health. As you said, you know, they get pregnant, their childbearing age, they get exposed to the doctors quite early in their life. The screening for cervical cancer is quite early in the life, while as the screening for men for colon cancer and other cancers quite later in the life. So they are more exposed, they are more open to talk, and open up about their feelings than men. And again, men are sort of groomed and taught as to be quiet and not open up to the emotions. They don't show the emotions, while women are quite comfortable showing their emotions. Men see the emotions as a sign of weakness. So that's again sort of touching on to the, the tough guy superhero kind of the superhero syndrome that the men sort of suffer from. So the presentation is sort of either a woman talking on behalf of the men, booking their appointments, giving the history. If they're not accompanied, if they're on the phone, it's the woman saying that, if she's able to talk to the GP. What we then do is we try and steer the conversation towards the man. So we do talk to the partners, but then we try and talk to the men. It's difficult with men in terms of opening up, as I said, and sometimes simple things that we can deal with in one appointment with a woman, we have to sometimes give more time to the men. 3 appointments, more than 3 appointments, to actually sort of gain some confidence and gain some sort of mutual comfort where we can talk to each other. So it's more time consuming. It's difficult to communicate in terms of touching up the actual problem. They're quite embarrassed as well, because if you look at the men's physical problems, most common problem is prostate problems, for example, that sort of starts happening around the age of 50. And all these problems, they require intimate physical examination, and they're not comfortable. Men are not comfortable with that. So it does take more time, more effort. They would like to see the same physician. They don't want to tell their story to a new person. So that's one thing. The comfort zone is not there. The embarrassment is there. I think then again, as I said, because they're not exposed early in their life, that part is there as well. And then I think with men, the difficulty is that as they have said, the mental health issues going on at the same time, they won't open up with their stresses. They're stressed about their physical health, but they won't address it. And I think there's an element of fear as well. They're scared because they're scared of the diagnosis. So say if we say we need to do some tests because we want to do some diagnosis, we want to reach a conclusion, they get scared. They don't want to hear anything to do with simple things like even diabetes or hypertension, because that makes them weak. Again, sort of going towards that masculinity, that burden of masculinity. So that makes them weak mentally, physically, and they don't want to go there. They don't want to even explore that area. So I think these are the main sort of things: the fear, the comfort zone, the embarrassment, all these things.
Ayesha, you've touched on so many important points there, and I was really interested in what you said earlier on about ladies or women from a very early age having interaction and contact with healthcare services, and obviously that all primes them to be, for them to, it makes it easier for them, while men sort of get in contact later on in life, and something which they're not used to. I'm going to actually come back to you on that because it's really, really important. And, some of these things that you've discussed, and I'm being a transcultural psychiatrist myself, I'm not going to let either of you go away without touching on this element. And I'm going to come back to you in a minute, Ayesha, but I just want to ask Tayyeb, Professor Tayyeb, just in relation to what Ayesha said just now, and just also in relation to what you've been saying earlier on, do you see any cultural difference, be they Afro-Caribbean, be they South Asian, be they from the Far East, be them from the Western communities? Do you see, or have you seen in your experience over the years, difference, and specifically, obviously we're talking about men, in the presentations?
Shahid, I'm very grateful for this question. It's such an important point to address. You and I, we know the difference between presentation in men from different cultures. For example, medically unexplained symptoms or somatization symptoms, which we sometimes do not recognize very clearly, and we end up doing.
Just for the sake of our listeners, Tayyeb, just do explain what is meant by medically unexplained, just because this is really important. I really want you to touch on this, and also somatization, so that our listeners do understand.
We can do another 1 hour show on this if at some point, but medically unexplained symptoms are when people present with various physical health symptoms, but when you investigate them and over investigate them and reinvestigate them, there's nothing that you find on physical health investigations, and people come to doctors like Ayesha in general practice complaining of for aches and pains, indigestion. Let's not forget the most important question that we fail to ask or are embarrassed to ask, sex drive or libido. And those somatic symptoms, sometimes when you investigate fully and you don't find anything, that needs attention. And even ICD-11 and DSM-5, they've talked about these somatic symptoms as full chapters, and it's important to address those fully. And people should be aware, general public should be aware, lay people, that if they have symptoms of physical nature which get investigated and there's nothing that they can find on those investigations, then it's important to seek help appropriately from people who can deal with physical and mental health together. And it's not essentially a psychiatrist that need to see, it's not essentially a psychotherapist that they need to see. They need to seek help from their GP, who would be perhaps very much in tune with these, because 30 to 40% of medically unexplained symptoms are seen in general practice. And only a tip of the iceberg comes to mental health services, and usually it's the serious, complicated, complex cases that come to us. So nipping in the bud early on is very important, and hence talking about men and mental health early on, even before they get married, getting into relationships is important. I mentioned ADHD before. Young men can present with sexual health concerns, and hence those are the points to be addressed. And you asked a question around difference between different cultures, and those are the things that doctors need to keep their eyes and ears open for. And usually, like Ayesha said, usually it's at the end of the consultation when they drop a hint, by the way, doctor, can I ask you about this? That's the time when you latch onto that, by the way, doctor comment, and then ask more. But then I can understand GPs are limited by time. They've got pressures on them, 8-10 minutes to do a consultation. And hence having a good GP is like having weight in gold, honestly. And lots of issues can be dealt with early on, nip in the bud, before they really become a serious concern.
Absolutely, absolutely. And I will come back to you because you've touched on something, and I'm so glad you have, on impact, and something that we left as a taboo subject, and that is our not only sexual health, but also the medication that we sometimes take. So we'll come back to that in a moment, Tayyeb, just to talk a little bit about some medications and where the reluctancy to take the medication is. But I wanted to, before we do that, I just want to ask Ayesha the same question. So culture and physical health problems, men and difference in presentation.
I think most of the time, as Tayyeb has mentioned, it's, all men suffer from all sorts of mental illnesses, and same as physical illnesses. The way they present is almost similar. There is a bit of cultural difference with regards to when we talk about especially medication, initial presentation is most of the time same. So either your wives are forcing you to get the appointment, see the GP, or your children. So it's almost similar cultural wise. There is reluctance in terms of taking medication. There's reluctance, especially in certain cultures. People don't want to take advice, lifestyle advice, mental health advice, medication. compliance is really, really poor in certain groups of, if we talk about Southeast Asian sort of background, if we talk about ethnic minorities, there's really poor compliance. And I think that is linked to the lack of awareness and lack of education as well. There's also the cultural, the social background of these ethnicities that sort of leads to not bother taking medication. They're not going to do anything. That kind of mindset is there with certain ethnic minorities. So that then leads to obviously more complications in their physical health, and they do need extra time. They do need a lot of education. We spend many appointments just sort of doing medication reviews with these patients so that they understand why they're taking these medication, what are they doing, why we need to follow them up, why do they need regular blood pressure checks and regular blood tests. Regarding lifestyle, it's a big one. It's very, very difficult to change the mindset of people about the lifestyle. Lifestyle is so important. It's linked to both physical and mental health issues. So yeah, it's a difficult one. But I think with a lot of time and effort, you do sometimes get some reward, and there is some understanding. But as I said, difficult one. We need to make people more aware, I think. That's the answer.
Absolutely, Ayesha. And it just reminds me, some of the things that you've just said, just reminds me of my experience when I came back to the UK after completing my medicine. I was waiting for my registration, and I had about 6 months to play around with. So I worked as a phlebotomist in a hospital in London. And I remember that one of the most difficult patients to get blood from were males. And males just did not do pain. And females were much more easier to be able to do that. And males don't do pain, Ayesha, do they? I mean, is that something you've experienced?
Well, you should have said man up.
Our pain, okay.
No, you should never say that. Sorry. Yeah, they are, I think they're quite scared, and that's fine. You can be scared. It becomes a problem when they don't understand the seriousness of physical health or mental health, and they sort of delay, and they don't want to know. They just don't want to know. That's the problem. So our job is, I think, to carry on sort of telling them, advising them, and giving them information. That's all you can do. And it works, and most of the time it does work. I mean, I think things are changing now, and I think people are listening, and it's age of social media. So Google Doctor is there. So if you're shy, if you're scared, if you don't want to see anybody physically, you can pick up the phone and speak to somebody, or you can do it over the internet to save the embarrassment. And so I think there are things available now that can help. But as far as the cultural difference, I think that's happening as well. I think I've seen a lot of actually children of the new generation, sort of, they're booking appointments for their parents, their fathers who are reluctant to go see the GP. They're getting online doctors, and it's changing. I think there is a change.
Excellent, thank you.
Yeah.
And Dr. Google is another topic, a discussion for another day, isn't it? So we will touch on that. It's a separate one. So you're listening to Ramadan Radio 87.7, and we are on ramadan.fm. Give us a call. We've got about 10 minutes left. So give us a call. This is your opportunity on 0116 482 2086, or WhatsApp us, or send us a text on 07748 855 055, and we are live streaming on Facebook and YouTube on ramadan.fm, so join us there as well. Tayyib, just coming back to some of the point that you raised earlier, and I think it's really important, and I just want to hone in on a specific form of medication because it's so widely used. Number one, people are reluctant to use it, and number two, when they do use it, they may experience some side effects. People like Ayesha in her role, I know I will ask Ayesha the same question, but obviously it's so important for them to also have those discussions. And I know you've touched on it as well. Antidepressants are notorious for causing sexual side effects. Please throw some light on that, Tayyeb.
Sure. Before I answer your question, can I say Dr. Google didn't go to medical school?
Absolutely. Very well said.
And that ties in with the answer that I'm going to give for antidepressants. Antidepressants are crucial for treatment, and counseling around antidepressants is very important. My late teacher, he said in psychiatry, he said, look, antidepressants are good friends. You need to know them well before you talk to patients about them. So you need to know the antidepressants in and out of what side effects they have. You need to match up the medication profile with patient's symptoms. You need to counsel the patient about the side effects. Yes, they have side effects. Every medication has side effects. You talk of cholesterol medication, they give aches and pains. You talk about painkillers, they give side effects. So does the antidepressants, but it's important to counsel patients that they need to take medication in the right dose for the right length of time before they reject the medication. Yes, if they have side effects, like you mentioned, sexual side effects, for example, for young men, it is quite important part of treatment. So you need to think of the right medication which does not have sexual side effects. And those are the things for which you need to seek advice. And that's why I'm not going to name medications here right now, but it's important that doctors are aware of the side effects of medication so they can counsel appropriately. And another important point is you need to think of safer medications with people who have physical health problems. Hopefully I've answered your question, but I need to point out a couple of other things in terms of treatment. And I don't like the word treatment for depression. I think of management, and management is a biopsychosocial approach, which means the biological approach, dealing with physical health problems, dealing with medication, selecting the right medication for the patients, but also working on psychological and social therapies. Like Ayesha said, lifestyle changes. Lifestyle changes would be part of the psychological treatment, and that's the basic level of treatment. Progressive muscle relaxation exercises, things when I was a trainee I used to do myself, but now you can signpost patients to YouTube sources. And it's important that we listen to those YouTube resources before we recommend it to patients. And social therapy, i.e. job, security, accommodation, medical legal issues, all those things form part of the whole management, and hence knowing the patient and listening to the patient is very important. People come to my clinic referred by different specialties and say, I don't know why I'm here. And at the end of the consultation, after about 45, 50 minutes, they are hooked on and they're saying, no one has sat with me and talked to me about my physical and mental health together. When can I see you next? So listening to the patients, validating their symptoms and not brushing them under the carpet is important. And hence, antidepressants is only one part of the treatment, or other medications for psychiatric treatments is only one part of the treatment. And my advice to my colleagues, GP colleagues, is pick up the phone, talk to us. Do not just think that 2-minute consultation and prescribing antidepressants is going to solve the problem. If you are stuck, approach us. We might not be able to see patients quickly. There's a waiting time. And there's a message for if any politicians are listening to your popular show, please invest in mental health. If you want better health, invest in mental health. Increase the number of doctors with mental health background, whether it's in the GP, and make specific sessions for them. Increase social support. Simple things like psychotherapeutic work, there's a waiting time for a year to see those. And there's a message for politicians and people in power. Please listen to us.
Absolutely. And thank you very much for that very, very comprehensive response. I think you've covered all areas. And I think both Professor Tayyeb and Dr. Ayesha would agree that when it comes to antidepressants, specifically because we are touching on those, antidepressants do work and they are very good when it's indicated. But I'm glad you've also touched on the concept of social prescribing and the importance of the psychological and the social aspects of keeping oneself well, because they are all part of a spoke of a wheel. And antidepressants only go wrong when we don't prescribe them properly, when we don't take them properly, when we stop taking them suddenly, and we will have withdrawals, and that will cause problems. Absolutely. And then people may feel that there's a dependency, or they're very nasty medications. But also the reasons we have to understand, as both Professor Tayyeb and Ayesha have highlighted, that people may stop taking medication because of side effects which they don't want to discuss because they may be very personal. So it's really important. So we've got about just under 4 minutes left. Time flies when you're having fun, doesn't it? So I'm going to go to Ayesha first. And Ayesha, in about 1 minute, can you give us a take-home message for our listeners out there?
I think two things I would say. One is, I think as a society, we need to change our mindset. We have to stop saying to our children, young children, that stereotype that we have developed with males. I think we need to stop doing that. We need to stop saying, boys don't cry, be tough, be a man. We have to stop using those phrases as a society, because that puts a huge burden on men and change their mindset. And I think secondly, I think we need to address these issues of awareness and education, and I strongly feel that people need to be made aware via campaigns or public health. And I think it's a multi-agency approach. Sort of everybody needs to come together and work towards better mental and physical health, especially in men. So I think that's my second, and I would really want to talk about serious physical illnesses in men like prostate and colon cancer, and so they need to be mindful. They need to be careful because it's very, very common. They're very common. Every hour, one man dies of prostate cancer, every hour in UK. So I think that's really important. You need to look out for the signs. You need to see your GP. Just pick up the phone. Just ask for advice. Even if you have one symptom, just call and just ask for advice. So I think most important message would be that seek help.
Excellent.
Call
Fantastic.
up your GP.
Fantastic, Ayesha. Perfectly. And 1 minute, Tayyeb, for yourself as well. We just got under 2 minutes. So that's beautifully said by Ayesha. So Tayyeb, 1 minute from yourself, please. A take-home message for our listeners.
10 seconds of anecdote. I asked a friend of mine, a non-psychiatric doctor, how many patients do you see in your clinic? And he said, none. I said, how can that be possible? He said, because I don't ask about it. So I gave you ABCD for my doctor colleagues. Here's an ABCD for my patients or general public. Ask for help from your doctors. B, don't think you need to be brave. C, please consider talking to your doctors. D, don't go down the poor coping skills of drugs, alcohol, addiction, and all sorts of other things. And one last thing, dementia, we didn't talk about it. Elderly men, dementia is a big thing to consider. And early onset dementia is even a bigger minefield. I'll stop here. Thanks, Shahid.
Absolutely. And you've both done wonderfully well, covering all areas between yourselves. Listen, I've learned a lot from both of you. It's been absolutely fascinating. And I just want to say thank you again to both of you. We've just got less than 30 seconds to close now. So I wanted to say thank you to both of you for sparing the time and giving us what's out there, and also pearls of wisdom, some lovely anecdotes and some lovely points for our listeners to consider and I'm sure that it would be benefit for the community. So thank you once again. You've been listening to Ramadan Radio 87.7 FM. I've been your host, Dr. Shahid Latif, and see you next week.